Please take a moment to read this disclaimer, pause the video if you have to, and understand that performing any of the stretches in this video means you are accepting any and all risk. Thank you. Today I'll be performing some of the more basic hip stretches. Now these are ones that I need. This is my hip flexibility journey that I am showing you that you can participate with me if you've been cleared by a medical doctor. So first we're going to start with the hip flexor stretch here. Now this is one in my clinical rotations that I think everyone should be doing. Now this stretch really goes after the iliopsoas and the quads, and there are variations of this hip flexor stretch. You've probably seen people doing the standing quad stretch at soccer games or before running a marathon or something. This is designed to go after those hip flexors, and one of the reasons why is we sit a lot. So the hip flexors really need to be stretched when you have a sedentary lifestyle. Otherwise, they're just going to get used to being stuck in that 90 position like you see my left leg there. So this stretch is one of my top 10. Absolutely works for me. The issue is that a lot of people don't actually hold it for as long as they should. So a lot of people want to hold it for about 10 seconds and let it go. But the studies have come out and said that really anything over a minute is what you need to do in order to get the benefits of this stretch. Now, I'm doing my best to count in my head here to 60. Probably a little bit slower. If you timed me, I'm probably going a little bit over a minute, but that's just to my benefit. Now, when I dose these for my patients and my physical therapy rotations, my clinical rotations, I usually dose these for 3 1-minute holds. I'm only doing these for 1 minute just to give you guys an idea of what I'm doing. You can even see here there's a side-to-side difference, my left hip versus my right hip, and when performing these you will probably see the same thing. Now, really important here from this angle, imagine that my shoulder, my hip, and my knees make up 3 points of a line. You really want to get your hip in front of the knee and in front of the shoulders. Now again, all of this is predicated on the fact that you've been cleared for physical activity by a doctor. You shouldn't be performing anything that you see in this video without consulting a medical professional. Make sure that you've been cleared to do these stretches. And in the future, any exercises that I demonstrate. So again, one of my top 10s for sure. This is one that I need all the time because of how often I am sitting. And chances are, if you've been medically cleared, this is one you probably need just because of the sedentary lifestyle that we happen to be living here in the West and or developed countries that focus on technology or manual labor, but like sitting, maybe like factory work and such. Alright, so here we're going to transfer to the next position. Yep, we're going to be doing the piriformis stretch. This is a pigeon stretch. Now, what's important for this one is that front knee comes up in front of the body, leg across, and you're actually taking your hips and moving them away from the knee. So my knee's right about midline, right in the middle of my chest, and I'm actually taking my right hips and trying to bring them away. And this stretch is really going to be felt in the hip. It's going to be felt in the back of the hip. And I'm definitely feeling it here. The piriformis is, again, one of those muscles that a lot of people have tightness in, a lot of people have trigger points in, and it comes with being sedentary. It's just one of those muscles you sit on a lot. Maybe you don't use it much. Maybe it's getting weak because you're not working it out as much. There's a whole host of reasons. But when this muscle becomes tight, what it can do is actually squeeze down onto the sciatic nerve. And the sciatic nerve, as most people have probably heard at some point from someone over the age of 45, they're complaining about their sciatica or how their leg hurts or they have that shooting pain down their leg. And so the piriformis actually is penetrated by the sciatic nerve. And when the muscle gets really tight, it actually squeezes down the nerve, and that's what can cause some referred numbness, pain, and tingling. There's actually some specific tests, I think I've posted a couple of them on my channel already, that you can do to see if you have some sort of sciatic involvement that are used by physical therapy in the clinic to check this out. Now, most of the time when you're seeing sciatica, it could be due to a tight muscle. It's somewhere in the chain that nerve is being pinched. It could be in the low back. It could be in the piriformis itself. It's not a fix-all. It's not a cure-all. It's not going to solve all of your problems. but having looser muscles that are not squeezing on nerves is definitely something that's beneficial and something that I think we would all benefit from. Now, if the nerve is being pinched somewhere above the piriformis or somewhere below the piriformis, obviously this would not help, but mine are very tight, and I do not want to have any involvement of my sciatic nerve in the future causing any shooting, numbness, tingling, or pain. So I'm going to be treating this as a preventative. I'm going to be going after this just in case I'm already getting any tightness, because I very clearly am. This is not a beautiful pose. This is the pose of a man who has far too many tight muscles, all competing for attention right now in this position. In a couple minutes or a couple seconds here, I'll probably get ready to transfer to the next position. At this point, I've probably lost count, and I'm just guessing, okay, maybe I'll add 10 more seconds and I'll get there. Yes, this is also what physical therapists do, in case you're wondering. Whenever we lose count and you're holding a stretch, we go, yeah, how about 10 more seconds? All right, so here we're doing the hip adductor stretch. Again, this is one that so many people benefit from. A lot of recreational runners, a lot of recreational gym goers, a lot of weekend warriors. Many people neglect their adductors. What is an adductor? An adductor is the muscle that's on the inside of your thigh. There are several of them. I think there's about 3 of them. And when I was doing this stretch, I actually felt it in two very specific different muscles. There's adductor magnus and adductor longus. I felt it at this one. I'm feeling it magnus. Magnus meaning, of course, big, right? It's the largest one of them. Longus, I think, being the longer one. I could be completely mistaken. But we're not going to pause in the video and go and look this up right now. We're going to focus on the stretch. Fun fact, too, Kevin Hart actually tore one of his adductors while he was running. He was doing a sprint against, I think it was one of his sons, and he actually tore this muscle. This is definitely one that people neglect. Again, it just comes with the sedentary lifestyle. You're not really using those adductors to squeeze your thighs together. You're really using them, at least nowadays, mostly in walking, what we call gait in physical therapy. And when you don't stretch them, they do impact your gait, they do impact your running. And so stretching them is very important. When you're working these out, this would be when you're sitting on the hip adduction machine. So it's one where you're seated and you have the pads in between your legs and you're having to squeeze them together. So it's starting with your legs open and pulling them together. That's your adductors. When you push them apart, that's your abductors. There's some fancy 10-cent words from you from the PT world. So in this position, I was definitely feeling it in the longer muscle of the adductor. I was feeling all the way down, almost in my knee. And that's fine. You're probably going to feel this in different positions on the inside of your thigh, where those adductors are. And it doesn't have to be the same. Different muscles will be tight in the same region, and you might feel in different places. You can see I'm really struggling to try and bring my torso back to neutral because of how tight all those muscles are. Again, this is the position of a man who has very many tight muscles all competing right now to try and keep me from doing the position as best as I could, which is one of the reasons why I'm doing this. I'm inviting you on my stretching journey in order to give myself accountability, in order to show you guys what I'm doing as a physical therapist to address my own mobility issues. All right, so next we're moving on to one that is super easy. This is just the glute stretch. Why am I doing this? I'm doing this because a lot of people have tight glutes, and also because after doing the adductor stretch, I needed a break. So again, glutes, you got 3 of them. You've got glute max, glute med, and glute min. They are responsible for doing several different motions. Really what they do is they focus on hip extension. That would be pushing your leg straight back. They also work in abduction, which we're talking about kicking that leg out to the side. You've probably seen people exercising their glutes at the gym. You've got the hip thrust machine, which I love. I think a lot of people have weak glutes and they could definitely benefit from the hip thrust machine. You've also got usually people doing some sort of single leg Romanian deadlift. They're working out their glute med. Now, I don't know if they know that or not, but there was a study that came out that said that position actually really works out the glute med. because it's forcing it to stabilize you while you do that motion. And one of the things at my clinical rotations at one of the military sites where I was at that really surprised me is just how weak our hips get. Specifically men, we just really don't work out our hips, and it really comes back to bite us because we don't really think about how our hips are tied to our low back. And when your low back and your hips get weak, or something in your hip gets weak, your low back is going to try to compensate. A lot of the times there's these two muscles in the back called the quadratus lumborum, the QLs, and they are really having to work hard if your hips are weak. So while I was stretching out my glutes here, I was thinking about probably another video I'll be doing here, really focusing on hip health, because a lot of us men neglect it, and even soldiers really neglect our hip health, and it comes at the cost of our low backs later in our life. And I really think the biggest impairment most men between the ages of, say, 21 and 40 have is mobility and not strength. We're really good at going to the gym and working out. We're not good at targeting what areas need strength, and we're really not good at doing mobility. And so if we focused more on mobility, we'd probably feel some of those areas that could benefit from strength, and we could go in there and target it. But generally, big pictures speaking, strength isn't as much of an issue that I've seen in the clinics as much as it is mobility. Though some muscles like the hip abductors and hip extenders really do need work on most men. And of course, we're going to do the hamstring stretch. This is a very low-level hamstring stretch. You can just see that I'm incredibly, again, my hamstrings are the tightest muscle in my whole body, and I'm really trying to work on that here. I'm also probably going to add a hamstring stretch in the future that is pretty neat that I learned at one of my clinical sites. That's called reciprocal inhibition, where you use muscle activation of the antagonist. Now that would be the muscle that is the opposite action. So right here we have the hamstrings. What are they really good at? They're really good at bending the knee. So in theory, if I was trying to activate my quad, if I was trying to fire my quad to really push that knee down into the mat, what that would do is force my hamstrings to relax even more than they are. And the idea is that your body is hardwired to have an agonist, which in this case would be we'll say it's the quads. When the agonist is firing, any muscle that is antagonist to that is the opposite motion, must relax. And the reason why your body does this is it wants to, again, conserve energy, but it also wants to be efficient. And it doesn't want to just be efficient and conserve energy, it wants to be efficient around that joint. To have two muscles firing at the same time doing opposite actions around the joint only does one thing, and that stabilizes the joint. It doesn't allow for good movement. So when your quads want to fire, your body makes sure that your hamstrings are relaxed unless you are really focusing on voluntarily contracting them. And the idea being that frees up the quad to be the most efficient, to fire the best, and have the full range of motion that it needs. So there's a really cool iteration of this I'll probably demonstrate later, so keep your eye out for it, where I use reciprocal inhibition at the quads to help my hamstrings relax, to get a better hamstring stretch. Now, again, this is a static stretch. We're holding it for a minute because the science says for a minute. I dose these 3 times 1 minute holds each. I definitely need these. And there's 1,000 variations of hamstring stretches that you've probably seen. This is just the one I went for. Any hamstring stretch that you do is a good hamstring stretch. As a PT, you learn that you can give 2, 3, 4, 5 different interventions, and it just really turns into the one that your patient does is the best one. Here's another one that a lot of people could benefit from. This is the Cobra Pose. Yep. Now, I have to do it this way. I have to do this, the whole coming through, almost from like I know it's a yoga pose, I can't remember what it's called. Anyway, I have to go from like a handstand through in order to get the proper alignment for my hips. And what you're going to see here over time is those hips are slowly going to relax. I'm really contracting here in the glutes, in the quads, and I'm really trying to relax them, but it's something that really does just take time. You really have to breathe through that position and let your hips just slowly drop to the floor. Now, why am I doing this? My abs get really tight and my hip flexors get really tight, and so I'm double tapping here. I'm really going in and making sure my hip flexors are getting good stretch and my abs are getting good stretch, and I'm trying to help my hips get a little bit more mobility. Now, This is one that is also, you might feel a little bit in the adductors if they're really tight because your knees are kind of coming out in a way. You're also definitely going to feel it in your triceps and your shoulders, so I would not recommend doing this after arm day or shoulder day. Alright, let's see what we're going to do here. Oh, we're all done. Well, thank you for watching this video. I really appreciate it. I hope you liked it. Please follow me on my mobility journey. It helps hold me accountable, and I get to share a lot of knowledge with you all. And I also want to give a shout out to my patrons, Spunky Rufus, Jake, and Ben. You guys are amazing, and you enable me to be able to do what I'm doing. And special thank you to Robert Mason Sandifer for providing the amazing music.